Welcome to The Spine Guy. I'm Dr. Brian Sue, a fellowship-trained spine surgeon. The Spine Guy is a channel dedicated to making the complex spine simple for patients to understand. Today we'll be talking about OPLL, which is a unique but not that uncommon condition in the cervical spine or neck. So first let's unpack what OPLL stands for. The O in OPLL means ossification, which is something that is soft tissue turning into calcium or bone. And the PLL stands for the posterior longitudinal ligament. Now, ligaments are soft band-like or rubber band-like structures anywhere in the body that connect one bone to another. So this is the cervical spine. This is the front of the neck, this is the back. These are the bones. In the back, if I were to open it up, there's this ligament in the back, which is represented by this soft band-like structure that holds the bones and connect the bones together so that they have stability when you're in flexion and extension. OPLL is when that ligament slowly ossifies or turns into bone over time. Now, even though that ligament actually runs everywhere down the entire spinal canal, for some reason it tends to only turn into bone or ossify in the neck. OPLL does have a genetic component, but it's not classically inherited like eye color. And it's actually very common in Asia. Believe it or not, 3% of the Japanese population has OPLL versus only 1% in North America and Europe. OPL is multifactorial, so there might be a partial genetic component, but there's also probably an environmental and a metabolic component as well. Now, if we look at the spine again, inside the spine and right behind the posterior longitudinal ligament sits the spinal cord. Now, spinal cord obviously carries all the signals from the brain down to your entire body. As that ligament ossifies and becomes bigger and bigger, it forms this giant island or lesion of bone that can push on the spinal cord and then cause symptoms. Now, since ossification is calcium or bone, imaging is really the only way to tell if you have OPLL. Now, it turns out that x-rays, they can look at bone, but x-rays aren't fine enough to really detect OPLL. Now, MRIs are very good at looking at soft tissues like the spinal cord and discs, but an MRI, in fact, is not very good at telling whether or not something is bone or not. CT scan, which is basically an MRI that uses x-ray, is the gold standard for detecting and diagnosing OPLL. So here you see a normal MRI showing the brain, the spinal cord coming down. The white stuff is fluid around the cord, and these are the bones, these are the discs, and there is a fine ligament that runs in the back. It's just very hard to see on the MRI. Now, if you look at the CT of a normal patient, you'll only see the bones. This patient doesn't have OPLL. So you see the bones, you see the gray area where the discs should be, and the ligament would normally run here. In a normal patient that doesn't have ossification, you wouldn't see it on the CT. Now, this is the MRI of one of the patients I've operated on. You can see here that there's some cord compression at C4-5 and C5-6. You can see that there's reduction in the spinal fluid. There isn't a lot of fluid around the spinal canal. And it might just look like a normal disc that's bulging out hitting the cord. If we get a CT scan in this same patient, here you'll see this flowing ossification or this ligament that turned into bone, and you can see the bone is seen as this white stripe coming down right behind the discs as well as the vertebral bodies. Now, there's different types and degrees of OPLLs you can imagine, ranging from a small amount of bony growth just behind the bone versus here's a very severe case where you see there's an entire giant sheet of floating bone versus some lesions that are only at the disc level. Now, cord compression can be asymptomatic, meaning it's not causing any problems, or it can obviously cause issues related to compression of the spinal cord. So symptoms related to cord compression is something called myelopathy, and the symptoms of myelopathy include hand numbness, hand dexterity issues, weakness in the upper or lower extremities, balance problems, as well as urinary dysfunction. I have a great video on the Spine Guy channel that talks about central cervical stenosis when you need surgery from cord compression, and that video talks about bone spurs and disc herniations, but really, in general, OPLL follows all of the same principles on that video for when you need surgery for cord compression. There are, however, definitely a few good things to know that are unique to OPLL and how that lesion or bony island changes over time. Now, OPLL progresses on a CT in about 1 in 5 patients, so 20% over several years. And if it does progress, that lesion size can grow, and if it does grow, it usually grows at about 4% per year, which means in 10 years that lesion or bony island can get 40% larger than it is now. Now, among those patients who have a larger lesion size that's constricting the spinal canal, around 20% will eventually need surgery for myelopathy. And in general, the studies show that all patients who have more than 60% of canal occlusion, so a little bit more than half of canal occlusion, will ultimately need surgery. So the only caveat is that in my patients, if I have a patient that doesn't have myelopathy, but they have 60, 70% canal or cord compression, and I know that pretty definitively that person is going to need surgery, then we might be a little bit more aggressive in taking pressure off the spinal canal. Now, it's also very important to know if your cord compression is coming from OPLL or maybe something from a disc herniation or a bone spur, because OPLL does change our surgical treatment. So for this reason, I have a very low threshold to get CTs on my patients who I'm operating on who have spinal cord compression, because I don't want to be surprised during surgery, think that it's a disc herniation, but really that patient has severe OPLL. Hopefully you learned something about what OPLL is and when you might need surgery for it. In our next video, we're going to talk about the different surgical treatments of OPLL. Thanks for watching, and don't forget to click like and subscribe.